currently at the MedVet with Debo. He has a swollen saliva gland, so we're here to get him a consultation for a surgery. So currently, I'm in the room by myself, and Debo's off being weighed, so I will check back in with you guys in a minute. Hey guys, this is Mia. Debo's back. Debo, come say hi. And we got great news. Debo's gonna have his surgery tomorrow. Huh, fat boy? You gonna have your surgery tomorrow? He's gonna have his surgery tomorrow, and I got wonderful news from the VA. I'm like so happy right now. God is so good. And I could so cry, but I'm so trying not to. But my baby's gonna feel better. Hi, Debo. Mommy's baby's gonna have the surgery. Come here, fat boy. It's something on the floor he's more interested in. Debo, come on. You gonna say hi? Look, right here. You usually like the camera. Let's turn it around. Hold on. Hey, Debo. Debo, are you gonna get better? Mommy's baby's gonna get better. Yes, you're the mommy's baby. Mommy's so happy. Mommy's so happy. Mommy's so happy. Yes, we are. We're so happy. Mommy, that's you. Yes, Mommy, that's you, fat boy. That's my fat boy. Yeah. Okay, so we're ready. Sit down, babe. Sit down. Sit down. Good boy. Good boy.
Okay, so you have multiple salivary glands. So what's on the one side is going to be on the other side.
Mm-hmm.
So starting with underneath the jaw, which is the one we're concerned about him, you have a mandibular one.
Mm-hmm.
And it's the largest one that we have. Mm-hmm. And it's attached to a conduit that empties all the way underneath your tongue.
Yeah, because I see it when it raises its
that
tongue.
swelling, exactly. But it's also attached to multiple tiny little salivary glands throughout that whole ductal system. So that's our biggest complex that we have.
Mm.
And that's probably why the one is most traumatized, because it's underneath the tongue. So anything that gets chomped on or pushed in there can traumatize that, and therefore obstruct the outflow of that saliva.
Okay.
Then you have one underneath your ear called the parotid gland. Usually not a major problem, but if it does cause a problem, it drains out right above the major canine tooth here. Mm-hmm. So sometimes you'll see it there, and sometimes you'll see swelling in the back of the throat, so they'll have a harder time breathing. Okay. And then you have another one underneath your eye called the zygomatic salivary gland. Mm-hmm. And usually if that one causes a problem, your eye starts to pop out of your socket. Okay. So obviously his is right here because it's underneath his tongue and such like that. Yeah. So removing a salivary gland, whether good or bad, does not cause him to lose saliva.
Oh, okay.
Because he's still going to have the whole entire other side, and he's still got two other glands on that side. So he's not going to be any less dry mouth than he was before surgery. Again, for the good or the bad.
Yeah, he's very wet mouth.
Handling him, he's a very wet dog.
Yes.
So, but it's not a big deal surgery to this kind of a clinic.
Okay.
They are problems because they can get better on their own, but they very commonly come back again and come back again and come back again. Because the problem is that there is some kind of disruption from the gland to the tongue that's allowing this fluid to build up and leak out of its capacity. So what you're seeing on the outside here is probably saliva.
Yeah. And
it's very tenacious, viscous fluid. And over time, the body will resorb the water that's in it, but then you're left with this gooey, gelatinous goo in there. Okay. And for the body to resorb that gooey, gelatinous goo sometimes never happens. It will become this more fluidy kind of motion, but it still will be this big ball of tissue. Okay. So what we do typically is make an incision right here behind the jaw. We approach the gland, and we pull the gland out, and then we take as much of the glandular tissue all the way underneath the tongue. Oh, okay. Secondly, then we come back and we take out as much of this swelling that he has here and remove that saliva, because it's very inflammatory and it will always be there if we don't remove it. Oh. The problem is that we can't it's not like a tumor where we can just go in and scoop it out, right? Yeah. It lives in a very important area that has lots of blood vessels and nerves and such like that. So we have to be careful about getting that out of there, and we can't just pull it out. So we can usually pull out about 75% of this capsule that it's formed, because the other 25% live near these blood vessels or nerves that we don't want to lose function from. So you can remove most of it. The point of this is that when he comes home, he still may have a swelling, but it's going to be more of a watery swelling, that over time is going to recapture itself and
Okay.
shrink up. So it probably and should go away within 2 to 3 weeks. Whereas in this
Come here, Debo.
situation that he's dealing with now
Debo, come.
will be there pretty much the rest
Come.
of his life.
And we don't want that.
Okay. And then the last thing we would do with him is underneath his tongue, we will make an incision into that swelling there and allow that saliva tissue to flow out from itself. So we would typically cut into that and marsupialize it, where we make the opening of that fluid into a kind of a new opening to the mouth. Over time, that will heal up like nothing ever happened, but it provides an opening for that fluid to drain itself out into his mouth. So it's a very common procedure, unfortunately, very routine for us.
Okay.
That means it's
I'm
less
kinda glad.
risky or anything. Anesthesia is always risk, but we do have an anesthesiologist and staff that do a great job of keeping them safe.
Okay.
Bruising and swelling, again, as I said, he's going to go home with some degree of swelling already,
Yeah.
just because of we can only remove part of that fluid in there. So, but the fluid is going to be completely different and it will resolve.
Okay.
And then,
I'm all
like,
for
secondly, infection, probably less than 2.5 to 5% of the cases, so not very common.
that. So will he go on antibiotics or?
Sometimes yes, sometimes no. Depends on when we're pulling that ductal tissue out from underneath the tongue. Do we have an opening? Since we probably will be, because we're doing surgery in his mouth and we don't want that to become infected.
Okay.
So he probably will go home on a course of antibiotics.
Okay.
There is a tiny nerve that runs right over our surgery site called the lingual nerve, which means it's innervating the tongue. Some people that don't have experience with the surgery can nick that nerve and cause it to lose function. And then you'll have a dog's tongue that's kind of paralyzed on one side and not on the other. That's not likely to happen in our hands. Again, I know my anatomy extremely well, and
Great.
I'm very confident that will be okay. So for the most part, very simple surgery for us to take care of
I'm
him.
glad to hear that.
And he should resolve and he should not have any problems. Does he have risk for this happening on any other of the glands? Who knows? I've not necessarily seen other glands pop up. Usually it's some kind of trauma that we can never pinpoint that caused it. And the healing consequences of that trauma, usually scar tissue, and that's what obstructs the ductal system for us. So.
Okay. Well, I feel better because it's been driving me crazy,
Yeah.
and I've been looking it up on YouTube
Yeah.
and what's going to happen. But
He's a good boy.
we need it done.
Yeah. It'll get him better. You're a good boy, buddy. I know. He's so hard not to play, isn't it? So hard not to play. He's a good dog.
So, when would you be able to? You want to go home outside and play? You're gonna have to get some rest tonight because you have your surgery tomorrow. Yeah, you have your surgery tomorrow, fat boy.